Hey everyone. Today I'm going to be talking about menopause, what it is, why it happens, and what are some of the symptoms you can actually experience with it, and what are some of the things we can do to help you through it. So menopause is technically defined as having no menstrual cycles for at least 12 months. And we use that as a pretty hard and fast definition as doctors so that we can tell if a woman is having irregular bleeding after she's already met the criteria for menopause. And that distinction is important because once you're in menopause, you shouldn't have any bleeding. And if you are, it's really important for us to be able to make sure that that's not happening for an abnormal reason, particularly if there's something like abnormal cells or precancerous cells that are going on. So very, very important if you're already in menopause that you make sure that you let your doctor know if you have any kind of uterine or vaginal bleeding. With that being said, once you are approaching menopause, even the process of getting to that 12-month duration of not having a cycle can be very rocky. Most women will go from having regular menstrual cycles, hello Mimi, to having irregular menstrual cycles that are farther apart, usually lighter, and usually shorter. Again, another important criteria, because if you're having heavier periods and they're still regular, or you're having periods that are more frequent than the once a month, again, you need to let your doctor know because that's not normal. Menopause is usually things are kind of slowing down, the engine's starting to cool down. And so if you're having more bleeding, that's the opposite of menopause and not normal. While that's going on, while your ovaries are kind of on and off, the hormonal balance you'll experience is going to be completely cattywampus. And that's why you're having the symptoms you're having. It's the fact that your estrogen levels are on a monthly going up and down, as well as your progesterone and your testosterone levels. But now we have a whole 3 or 4 months where things have gone up and haven't come down, or have gone down and haven't come up. And it's that flux in hormone that creates the majority of the symptoms that you have in menopause. So oftentimes women will be like, oh, my hormones are not balanced, and that's what menopause is. Menopause is not an imbalance of hormones. It is a decline in your hormone levels of estrogen, progesterone, and testosterone. So if there's any kind of imbalance, that's not related to your woman hormones or in menopause. Okay, so we talked about what menopause is and what causes it. What kinds of symptoms can you look forward to? Most women will experience the most common one, which is hot flashes, a sudden feeling of just being flushed. Oftentimes at nighttime, it can be for a brief few seconds. Sometimes it lasts for minutes. It can happen multiple times in the day. They can start and stop. As in like you've had them for a few months, then they go away, they psych you out because you think you're done, and then they start all over again. Again, this is in response to your estrogen levels, and as often as your ovary will kind of start back up again and then slow down, you'll experience them again, and then they'll slow down. Once you are done with that flux, meaning once you're kind of done with your ovaries going back up and coming down with its estrogen production, that's when they will resolve. And the way I like to kind of point it out is, have you ever seen anybody who's in their 70s or 80s still experiencing hot flashes at night? Not likely, right? Most women are experiencing it during that transition because these symptoms are a result of the decline in your estrogen. Once you're down to the lowest level that your body's kind of going to get used to, you don't have those symptoms anymore. Those are the transient symptoms of menopause. Then there's the ones that are gradual and progressive. For instance, things like declining sex drive. That's the result of your declining testosterone levels, not estrogen. Declining vaginal pliability, lubrication, sensation. That's the result of your declining estrogen levels. Declining progesterone levels can have an impact on brain function as well as testosterone. So if you're having symptoms of like memory loss, feeling forgetful, can't find your keys, but they're in your hands, can't find your sunglasses, they're on your head, you forgot where you parked your car, that short-term memory loss, having a hard time multitasking, whereas before you might have been the kind of person who's like spinning multiple plates and doing it with ease, having mood changes, irritability, depression. Often this is confused with just generalized anxiety and generalized depression, but it's actually a woman could be experiencing it because of her hormonal change and decline. And other things are your muscle mass can actually start to decline, especially if you're not proactively doing exercises to maintain your muscle body content. So part of the reason why as women get older, they start to have sagging skin, they start to have more, less muscle tone, and that's because of the declining testosterone levels. So testosterone is a very important contributor to your muscle retention, your muscle growth, and overall your metabolism is a side effect or a product of how much muscle you have in your body. So when you have declining muscle mass, your metabolism is actually going to decrease as well. So when women are experiencing that, oh, I'm approaching menopause and now suddenly it's really hard to lose weight, suddenly even the same things I'm doing and same things I'm eating, and yet I'm increasing in my weight without changing anything. Or like most of us, we're eating a little bit more, we're working out a little bit less, but now when we try to do the exercises and diets that normally used to work, they're no longer effective. So that's actually still a product of your hormone levels. Other things include, and this can be like a result of aging, a result of childbearing, but the lack or declining estrogen levels can also affect a woman's ability to hold urine. So she can experience incontinence, dribbling, leaking, etc. And how do we address this, or how do we fix it? So I think it's maybe a matter of semantics, but I like to make sure my patients understand that we're not fixing menopause. I'm a huge proponent of utilizing modern technology and science for your benefit and increasing your quality of life, but menopause is actually natural. It's not supposed to be fixed because there's nothing wrong with menopause. Unfortunately, Mother Nature has a very funny sense of humor, and apparently we only needed hormones when we were trying to procreate. So when we start to reach the age where we're no longer trying to have babies, it's like suddenly we don't need estrogen or testosterone anymore. Unfortunately, that's where all the good stuff is, and that's where our quality of life comes in. And a woman's testosterone is really what's going to impact her, like we talked about, sex drive, memory, muscle mass, metabolism, weight, mood. So how we can alleviate these side effects or the impact that a declining testosterone level has on your body is by supplementing your body with testosterone. You can also alleviate the symptoms of hot flashes by taking transiently a very short-term, smallest amount dose of estrogen. And you don't need to, you're not replenishing estrogen that you need to have. Let me make sure that's very clear. Estrogen, as much as I love it because it gives us our womanly glow in our breast tissue, it is actually the cause or is associated with an increased risk in cancer, blood clots, and increased risk for cardiovascular disease. So we don't want to take estrogen exogenously, or we don't want estrogen from the outside coming into our body unless we absolutely need it. And we definitely don't want to be taking that if we have any kind of other medical condition or a history of cancer or blood clots or other cardiovascular disease, because you are going to tip the scale not in your favor. So definitely have a discussion with your OBGYN if you're considering starting estrogen treatment for hot flashes. Really, it's the only thing that estrogen hormone replacement is truly approved for, and that too for the shortest duration of time. The goal is to get that monkey off your back. Other treatments you can use for hot flashes are over-the-counter. Black cohosh or evening primrose is something I commonly recommend. I even recommend starting with that. And if you're not able to, then coming back and we can discuss other options. An interesting treatment that you can consider that is, again, transient but could be something that's used long-term is antidepressants. In low doses, antidepressants such as venlafaxine can actually alleviate symptoms of hot flashes. Not in the dose where you would be treating depression symptoms or anxiety symptoms. Fraction of the dose, rather. So those would be the things that you can consider. Going back to testosterone treatment, there are ways that you can take testosterone that are sublingual, topical, like a cream. There's injectable testosterone, and then there is the transdermal testosterone, which is usually something that comes in a pellet form. So if you're ever considering treatment with testosterone, which I am a huge proponent of, and let me rephrase that, not treatment, but supplementation with testosterone to, replenish your quality of life with testosterone. And that's not something that you have to necessarily wait till you're in menopause to do. Women can actually consider this even before that, but separate topic. If you are considering treatment with testosterone, it's important to know that testosterone is actually safe outside of having potentially excessive facial hair, or excessive hair where you don't want it and loss of hair where you do want it. It doesn't have any associated increased risk of cancer such as estrogen does, at least not particularly gynecologic cancers such as breast cancer or uterine cancer. So it's really safe. It kind of gets put into the same umbrella as hormone replacement, and so women often are a little intimidated by the use of testosterone because the fear that it could be, it could cause an increased risk of cancer, but we are actually referring to estrogen when we talk about that increased risk of cancer, not testosterone. Testosterone can be safely used, and as long as you are tolerating the potential side effects, including, like I said, excessive facial hair, loss of hair, or male pattern balding, acne, something I like to call clitoromegaly, or affectionately call having a baby penis grow. Side joke for those of you who have had treatment with me before, you know what I'm talking about. But really, outside of that, there is no significant side effect or risk factor associated with testosterone. Of course, when used with guidance with the medical doctor and under observation. So to wrap up, because even though I promised myself I was going to make this a 5-minute session, now it's turned into 2 more than 5-minute sessions. So recap: menopause, at least 12 months of not having any menstrual cycles. It can take some time to even get to the 12 months, and that is where you have the up and down of symptoms because of your up and down hormone levels of estrogen, testosterone, progesterone. That is typically what causes it, declining production of estrogen and testosterone. Once you have passed that 12-month phase, you can continue to have symptoms because your body is not completely clear of those hormones. And until you get to that steady state, you can continue to have symptoms like hot flashes. Other symptoms that occur are hot flashes, vaginal dryness, decreased sex drive, memory loss, incontinence, metabolism decline, weight gain, mood changes, and more. And then treatments that you can consider for this, again, symptom dependent, but if you are trying to treat symptoms of hot flashes, you can consider over-the-counter black cohosh, evening primrose. You can consider antidepressant low-dose therapy, or talk to your doctor about a very short-term low-dose treatment with estrogen. And if you have any questions about testosterone treatment, shoot me a direct message and I will tell you all about hormone replacement with testosterone. All right, guys, thank you so much for listening twice, and I will see you guys on Friday.